Hi, this is Mark Besser of Besser Healthcare. In this video, I will discuss genital herpes and its causes, risk factors, diagnosis, and prevention and vaccines, and our recommendation on how and where you can get tested. Either you want to know for sure if you are genital herpes free, or if you think you have genital herpes with fast, affordable, and 100% discreet, private, and confidential testing. What is herpes? Herpes is an STD caused by the herpes simplex virus or HSV. There are many different strains of HSV, but HSV1 and HSV2 are the most common. Herpes often shows no symptoms at all, but the easiest identifier, when symptoms occur, is an outbreak of painful blisters. What is genital herpes? Genital herpes is not a scientific term, it simply refers to where on the body the herpes simplex virus is located. Because HSV2 most commonly affects the genitals, society tends to associate genital herpes as always being caused by HSV2, although that is not necessarily the case. It is important to note that both HSV1 and HSV2 can be found in the genital area. HSV2 virus generally affects the genital area, and HSV1 is more disposed to the oral or facial location. Because most people recognize HSV2 as genital herpes, when we test for genital herpes, we test for HSV2. However, HSV1, as the cause of genital herpes, is increasingly more likely with the rise in popularity of oral sex. It's important to be tested for both strains of HSV1 and HSV2, as it's nearly impossible to determine which virus strain you carry based on the location of symptoms. When the herpes simplex virus comes into contact with the skin, it can infect skin cells and penetrate further and infect the nerve cells. This is a big reason that the virus will usually remain local to the area you first came into contact with. Genital herpes is extremely common. The CDC estimates that 1 in 6 U.S. citizens between the ages 14 to 49 has genital herpes. Chances are, you already know someone who has genital herpes. How serious is genital herpes? If you have genital herpes, you are going to be okay. Herpes is not life-threatening, and it's very common. There are certain lifestyle changes that you may need to adapt to, but your sex life is not over. While there is no cure for genital herpes, there are treatment options that can reduce the severity and/or frequency of outbreaks. How do you get herpes? Herpes is extremely contagious and is easily spread from infected fluids, like saliva, genital secretions, or skin-to-skin contact with herpes sore or the affected area. HSV1 and HSV2 can both be spread through vaginal sex, oral sex, anal sex. Even if a sexual partner's skin is free of herpes sores, it is still possible to get herpes, and this is called viral shedding. Though visible sores may not be present, the virus is still transmittable. The CDC states that herpes is not transferred through the use of toilet seats, bedding, towels, or swimming pools. Most cases of HSV2 are transmitted through physical contact with someone who already has the disease. Still, it is recommended to avoid sharing drinks or other inanimate objects that may have recently come into contact with infected saliva or secretions, such as sex toys. Herpes can also be transmitted from mother to infant during childbirth, especially if the mother has active genital sores. Because a newborn with birth-acquired herpes can suffer brain damage, breathing problems, and seizures, it's important to test for and treat herpes sores when pregnant. There is a misconception that when you discover you have herpes, you or your partner has cheated. This is often not the case. It is very difficult to determine how and when herpes was acquired because the virus can lie dormant for years. Can you get genital herpes again? There is no getting genital herpes again because unfortunately herpes is for life. There is no cure, and the virus remains in your body forever. You may or may not continue to experience outbreaks intermittently, but the virus never leaves the body. If you've contracted HSV2 or genital herpes, it's still possible for you to contract HSV1 or oral herpes, and vice versa. Is herpes contagious? Yes, herpes is extremely contagious. The virus is most contagious when symptoms are present. However, it can still be transmitted even if there are no visible symptoms at all. Condoms can help reduce the spread of herpes, but as they do not entirely protect skin-to-skin contact of affected areas, there is still a risk. Who is at risk of genital herpes? Anyone sexually active can get genital herpes. That being said, certain activities can put you at a higher risk for contracting certain STDs. Herpes specifically is a very contagious and extremely common STD, so while certain choices put you at a higher risk, there is still risk involved in most sexual encounters. You are at a higher risk of contracting genital herpes if any of the following apply to you: frequent changes in sexual partners, frequently engaging in unprotected sex, having oral, vaginal, or anal sex with an infected partner, having other STDs, especially HIV, which reduces the body's ability to fight off infection, prevention and vaccines of genital herpes. According to the CDC, the best way to avoid genital herpes is abstinence. Long-term, monogamous relationships and an emphasis on consistent condom use are recommended. Avoid sharing drinks or sex toys with others, and always have a conversation about your sexual status before engaging in sex. If your partner is HSV positive, make sure that they are taking antivirals to suppress outbreaks, which will prevent you from contracting the virus. Do not have sex with a partner who is experiencing an outbreak. Unfortunately, there is no vaccine to protect from contracting genital herpes. And now, onto our recommended genital herpes and other STDs screening company. Click the website link listed in the description below this video to see the list of their test centers in your area with the discount coupon. Or go to bessercare.com/STDcheck. Our recommended genital herpes and other STDs screening company makes getting tested for STDs a simple and convenient process in just 3 steps. Step 1. Order their STD 10 test panel or individual tests online or by phone. Step 2. Choose one of their 4,500 test centers nationwide. Testing only takes minutes. Step 3. Your test results are delivered in your online account within 1 to 2 days. The entire process is fast, affordable, and 100% discreet, private, and confidential. Remember, either you want to know for sure if you are genital herpes free, or if you think you have genital herpes, you need to get tested as soon as possible. Don't delay. Thanks for watching this video. If you like this video or find value from it, please click the like button and let us know what you think in the comments section below. Or if you have further questions or want to share something with us in private, please feel free to reach out to us at mark@besserhealthcare.com. And if you want us to include a certain topic in our next videos, please let us know in the comments section below, or email us. Also, subscribe to our channel and click that bell for you to be notified of our upcoming videos. See you again in our next videos. Stay safe and healthy, everyone.